Tonight, First Edition examines the case of the babies born damaged due to tranquilizers taken by their mothers during pregnancy. New evidence suggests that tranquilizers, also known as benzodiazepines, can cause symptoms such as epilepsy, learning difficulties, and speech defects in children. We talk to the mothers who believe their children are affected, and we reveal the first hospital-based study in the UK which looks specifically at the risk to babies born on benzos.
The evidence around suggested to us that it was the benzos that were causing the problem. And what we had, if we go for 94, 95, we had about 70 pregnancies, of which we had to admit to special care approximately 50% of the babies.
The damage caused by these drugs is incalculable. In terms of physical, mental and social problems, it is costing the country millions, if not hundreds of millions of pounds over the last 10 or 20 years.
People haven't listened to me over the years. They're just down and out bastards. And they really, really ought to listen to us and get something done for these children.
18 million prescriptions were written for tranquilizers last year. We conducted a survey of mothers in the Carlton area and found that 14% had taken tranquilizers at some time, with 9% admitting they were long-term users. Furthermore, 6% of our survey said they continued to take their benzos during pregnancy. That means that in any one year, possibly over 6,000 benzo babies are born in London alone. Sarah Good has looked closely at the trends in benzo consumption over the years.
We live in a very drug-oriented culture. Drugs are very, very normal in this society, and it's particularly women who take drugs. When we look at the sort of drugs in general, including all the medical drugs, it tends to be women who use them. And that's always been true historically. And it's increasingly the case that women are taking more and more drugs in our society, whether we're talking about hard drugs, street drugs, or whether we're talking about tranquilizers.
Would you say that the women you're talking to are addicted to their benzos?
I would certainly say they are addicted in the sense that they're taking huge amounts, up to say 200 tablets a week, and they've been taking them for a long time. But the way that they're also using them, binging on them, so that they don't necessarily see that they are addicted. And the other drugs that they're using, for example, the street drugs such as opiates, they'll be much more concerned about being addicted to those drugs than they are to the Valium, which they really don't see as important. They wouldn't see that as an issue particularly. And as a society, we tend to agree with that view. So, for example, when the women go into hospital to give birth, the hospital staff will be very concerned about their opiate use and much, much less concerned about their Valium use, which may actually be more serious.
Hi, Karen. How are you doing?
Hi. We've got 3 new clients for you today, James.
How many on benzo, just for interest?
2 on benzodiazepines.
Right.
One's actually a late booker, so we're probably looking at her coming in on the benzodiazepine.
So what are the effects of taking benzodiazepines during pregnancy? Dr. James Robertson and his team have carried out the first study of babies born to mothers taking these drugs.
Well, if you ask any adult what it's like to withdraw from drugs, the expression cold turkey, whatever you want, comes to their mind. And it's very difficult and it's very distressing. Now, babies can't tell us it's distressing except that they scream. And these babies have a scream that is different from a baby that's hungry, it's different from a baby that's dirty, and it's different from a baby that wants cuddling. It's a baby that's in distress.
Dr. Robertson found that by bringing mothers off their benzos during pregnancy, fewer of their babies were born in a state of withdrawal, requiring intensive care. He also found, contrary to accepted opinion, that benzos are in fact much more damaging to the newborn than heroin or methadone, with more benzo babies going into intensive care than heroin babies. He submitted his findings in a paper to the British Medical Journal.
What we would say is that in 94, 95, when there was a mixture of methadone and benzodiazepine used, we were emitting approximately 50% of our babies, 1 in 2. Whereas now when we have most of our mums on methadone only, we are emitting 1 in 7. And also, from a more subjective angle, you just need to ask the nursing staff whether they would rather have worked here in 96 or 95. And 96, we had far fewer admissions, yet far more pregnancies. So it has worked, and the prevention is definitely more successful than the cure. A proportion of these mothers book very late, anything up to 7 months or anything up to the appearance on labour ward. So obviously with those we can't win. We can't get them off benzodiazepines that quickly, and we wouldn't want to. And also if the baby comes early, then again we haven't got them off benzodiazepines. We've reduced them, and within the women's unit the drugs are step by step reduced, so that it's not a rapid reduction, so the baby's not withdrawing in utero, its level is slowly tailing off. And we have found that this works effectively, but it does take time.
Dr. Robertson is way ahead of the field. Most hospitals still have little understanding of the damage benzos can cause. But even more important is what happens once the baby goes home. Jackie Gillard believes the damage is permanent. She took benzos during both her pregnancies.
I was put on tranquilizers about 24 and a half years of age. About 6 months before I was getting married. I literally just woke up morning, had stomach aches, found it hard to go out the door, went to the doctors and she put me on these tablets. And they did make me feel better to start off with. And then we got married. Then I started to become very ill. Had to pack up work. I had very, very good jobs. I had to pack up work. Then I just lived a life of recluse. They're cruel tablets, they really are cruel. And if they've done that to adults, what are they doing to the children? We went to the doctors and I asked him, I must admit it was a very, very nice doctor. I asked him, could they have any effect? You know, I'm on these tablets and I knew then they were tranquilizers. And I said, can they affect a baby? He said, no, there is no evidence whatsoever to say they can cause any damage, any harm to a baby. And I disbelieve them 100%. And now they've both got severe learning difficulties. And one of them's so hyperactive you don't know how to control him sometimes. They're just, I know both, well, one of them has got ADD, attention deficit disorder, which is lack of attention completely. They've both got really short-term concentration span. But Matthew can remember what happened years ago, but he can't remember what happened a couple of hours ago.
Matthew's problems are particularly noticeable in the classroom.
Well, in his last school, the teacher literally taught the class with one hand on Matthew's shoulder and one hand holding the book, whatever, because he just couldn't sit down in class. And his teacher before that said, Jackie, he walks around in class and he sits down and you ask him why he's done it, and he turned and said, but I haven't done anything. And she turned and said, I honestly don't think that he knows what he's done. And that is true, because I've always thought it and never said it.
But how typical is Matthew of children born to mothers who took benzos during pregnancy? Beverly Steffert is a child psychologist who's been treating children like Matthew for years.
One of the problems is that these learning difficulties actually can't be discovered until the child starts to fail at school. They can only be assessed by a psychologist who looks at IQ and matches that to reading and numeracy and literacy levels and so forth. On the other hand, this is a medical condition, brain-based condition, that can't be looked at by the educational psychologist. This is a province of a doctor. But the doctor can't actually assess the learning difficulties. So you have got problems of different disciplines and where they see the boundaries of the discipline.
So the child ends up nowhere. The child ends up possibly being shuffled between the GP and the teacher.
That's quite right, each blaming each other.
And of course the mother gets most of the blame.
Of course.
So do you have experience yourself? Are you dealing with children that you believe have been damaged by tranquilizers taken by their mothers?
I've certainly noticed this. On the other hand, of course, I only see children who've got learning difficulties. I don't know that there might be other children whose mothers have taken tranquilizers who have not got these problems. That's why I think there really has to be some proper studies done. But I can say that certainly is the case in my practice. I've noticed a fairly high correlation between taking benzodiazepines during pregnancy, early stages in particular, and later problems at school.
Psychologists may have noted the link between benzodiazepines and learning disorders, but what scientific evidence is there to support it? Dr. Vivian Howard has been studying the damage to the brain caused by drugs taken during pregnancy and recognises that some of this damage is often unseen, resulting in subtle neural and behavioural problems.
Well, I would expect behavioural deficits to be the most sensitive index of change. I think by the time you're picking up changes in structure, that's pretty gross. But functional changes in behaviour, neurobehavioural defects, I would expect to be really the most sensitive index of change.
Dr. Howard believes these changes occur if benzos are taken during the critical periods of fetal development.
I mean, this is a very important concept to get across, is that things that to the adult might cause a sort of short-term reversible change at critical periods in development in the embryo can cause a devastating effect. I mean, a very obvious example of that is something like thalidomide, which is pretty non-toxic to adults, but if it just happens to hit the fetus during limb formation and it's sensitive, causes a very bad malformation. Now here we're talking about subtle effects, but there will be windows of vulnerability during which blocking of major transmitter pathways like the GABA system will predictably cause some change to the final product, and that will be lifelong.
Dr. Howard's work is supported by a major study being carried out in the USA. Professor Carol Kellogg agrees that tranquilizers interfere with the GABA system, a key nervous system in the development of a child's brain. She's spent years looking at drugs which cause neural dysfunction and has found one clear culprit.
The primary reason I think that we chose benzodiazepines was it was very clear that somehow those compounds interacted with GABA neurotransmission. And GABA is a very important transmitter in the brain. It's the major inhibitory transmitter in mammalian brains. And it's very prevalent. It's present in all regions of the brain.
Most significantly, Professor Carol Kellogg says the worst symptoms associated with exposure to benzodiazepines appear only after puberty.
The effects we saw didn't really become apparent until the organism went into puberty and developed into young adulthood. The levels of the transmitter and its function were developing normally and suddenly just slowed down in the rates of development, so that by young adulthood there are markedly lower levels of the transmitter in this region, markedly different rates of utilization of the transmitter. Hormonal responses, the corticosterone, the classic response that we make when we're placed in a stressor situation, it was blunted. It wasn't as dramatic as in controls. And many other effects that we have looked at.
So, what does all this mean? It could mean that thousands of adolescents in London displaying behavioural or learning disabilities might be able to trace their problems back to the tranquilizers their mothers took during pregnancy. At its most extreme, some believe that benzos may be responsible for a condition called global developmental delay, in which a child is effectively handicapped, often without speech and even confined to a wheelchair. Doctors maintain there is no definable cause for this condition, but Claire Thrower, who has a daughter who's been diagnosed with global developmental delay, believes that the tranquilizers she took during pregnancy are the root of her daughter's problem.
I have an 8-year-old daughter called Georgina, and I have a photograph of her here. And she is in a wheelchair and she has no speech, and obviously with that in mind, her whole life is going to be in the balance as to whether she'll ever work. I don't think she'll ever work. She'll always need total care. She has problems with her feeding, and life in general is very difficult for her.
So what's this got to do with benzodiazepines?
I was prescribed diazepam during the last trimester of my pregnancy, and the consequences of such have resulted in Georgina. I have letters here from the local hospital who administered the drug, and that state quite clearly that there were levels that the wording they actually use is significant levels of diazepam in her bloodstream 7 weeks after she was born.
Are you thinking of taking this further?
Yes. Oh, yes. Yes, I'm taking this to court. There's no two ways about that. Somebody has got to be answerable for what has happened to Georgie.
Frustrated by the wall of silence she's met over the years, Claire decided to approach the BMA about the issue of the damage done to her daughter.
Good morning. My name's Claire Thrower. I have had a letter from the BMA with regard to a question that I had earlier this week, and I'm not satisfactory with the answers they've given me, and I'd like to come and see somebody about it.
Okay.
Thank you.
Claire has still not been given a satisfactory answer as to the cause of her daughter's condition. The BMA stated that they're not a statutory body and have no legal powers to investigate complaints about treatment or prescribe medication. One person who knows what a long haul it is to get a fair hearing on the question of benzo damage is Dr. Reg Peart, who coordinated the only group action lawsuit ever brought in this country against the manufacturers of tranquilizers. The case was unsuccessful and is now before the European courts.
Children born with physical and mental defects due to mothers who've ingested these drugs have very, very little chance. The action will be against the prescribers, and they will be represented by the Medical Defence Union, which is an extremely powerful body.
Why do GPs and many consultants I've spoken to the London area refuse to even contemplate this as an issue worthy of debate?
I believe that many prescribers find it very difficult to come to terms with the damage that they have done to hundreds of thousands, if not millions, of patients. They are, in essence, in a state of denial about the problem. If they accepted the problem, had the courage to be honest with themselves, they would have to inform and advise thousands and thousands of patients and actually do something about the problem.
So who is at fault? Why are GPs continuing to prescribe benzos to women when the evidence suggests that they and their children might be damaged? Dr. Ian Clark, a specialist in tranquilizer addiction, believes the problem has a lot to do with the particular needs women bring to the surgery.
I think the problem here is that, of course, men go to the pub and have a pint and let off steam that way, whereas women don't have that option, especially if they have small children at home. So in order to have their safety valve, one of their safety valves would be to go to the doctor perhaps and ask for some sort of help. And I'd certainly say that even this last week I've had 2 women come in wanting something to calm their nerves after family rows and problems.
Dr. Clark has patients referred to him for help with coming off benzos who've been taking them for anything from 5 to 30 years.
Many people will be able to reduce gradually, cutting down their tablets, and come off over a period of months without any major problems. But there are a great many who will run into the problems not just of the side effects of withdrawal, the anxiety that the withdrawal creates, but also the extraordinary prospect that they're discovering 15, possibly 10, 15 or even 20 years of their life, which has completely passed them by while taking these pills.
Whilst GPs like Dr. Clark know full well just how addictive tranquilizers are, the bottles still carry no warning to this effect, let alone any mention of the potential harm to the fetus if taken during pregnancy. We contacted the 2 largest manufacturers of tranquilizers in this country, but they declined to take part in the programme. Dr. Andrew Herxheimer is someone who's been monitoring both the drug manufacturers and the statutory bodies which regulate them.
Thank you.
I think the difficulty in getting the Committee on Safety of Medicines to accept that a warning was necessary about the addictiveness was just that it was, they didn't believe it. They didn't agree that it was addictive. And it took too many years for them to be convinced. I think that new ideas do take an awful long time to get through to people, especially people who think they know a lot, like the eminent members of committees. The difficulty is that there isn't any agreement, or there wasn't any agreement, on what it was that was ruining their lives, how it was happening. And nowadays we know much more about the harm that it can actually do.
If the medical establishment has taken 30 years to admit that tranquilizers have potentially damaging side effects, it's hardly surprising that the public see them as harmless. Sarah Good explains why.
Tranquilizers particularly seen very much as quite a sort of a soft, a safe drug because they're seen as a medical drug, and they'll use them as a sort of a coping strategy to help them to get through their everyday life. We could see that as a kind of another version of mother's little helper, to help them with the childcare and to just help them with the daily routines of life. What we tend to see is that drugs which are predominantly taken by men or are perceived as being taken by men, such as heroin, tend to be seen as extremely dangerous and perhaps slightly glamorous, whereas drugs which are predominantly taken by women, such as tranquilizers, are seen as a very normal everyday part of life and really nothing to get fussed about, quite trivial. And I think it is still the case that doctors are handing them out.
But it is possible that things may be about to change. James Tighe, a psychiatric worker in London specialising in drug abuse, has known about the problem for years.
The rumour amongst drug workers in London is that the government is considering putting benzodiazepines on what's called the controlled drug prescription. That's the same prescription pad that we use for opiates, so that doctors do have to handwrite and have to write in letters and numbers and totals, etc. And I can only hope that that is the case so that we can get some kind of handle on this problem.
Which you think presumably is a serious?
Yes, I think it's an increasing problem because the number of women drug users in this country and in London is increasing faster than the rate of male drug users. And I think that we have to bear in mind not only will these women often bear children, but they'll be responsible for parenting them. And I think we as a society need to support them in that role. And I don't think giving them lots of drugs, basically, is being very supportive to them.
But is placing benzos on the controlled drugs list enough? What about the many children growing up benzo-damaged today? And what redress do mothers like Claire and Jackie have, who've been looking for answers on behalf of their children for over a decade?
There doesn't seem to be any specific answers. Nobody has come up with the right answers, and you're left to it. You know, the drug is prescribed, the consequences happen, they do umpteen tests on your child, they find nothing, in inverted commas, medically wrong with her, and you're left to continue life forever and a day with Georgie in a wheelchair and no speech. And I find it extraordinary that there isn't anybody who's answerable for that. It's beyond comprehension, and I'm not the only mother in the world who probably feels the same way. I'm very, very angry.
Before I even had my children, there was evidence that actually banned tranquilizers and damaged babies. And I put it all down to them, well, my children have got learning difficulties. And I have a guilt every day they walk out this door. And I honestly think that doctors should take some of that guilt away from me and help.